Sjogrens is something we're going to pivot into here, guys. It's Highway to Health. It is one of the longest running segments on the Dave Nemo Show, which is now Road Gang Radio, all part of Radio Nemo's lineup. And it's something very important. This one is particularly important because Sjogrens, which, by the way, is spelled Sjogren, Sjogren's disease, is what we're talking about today with Janet Church of the Sjogren Foundation. She's the CEO over there, and Dr. Don Thomas, who is a specialist in both that and lupus. This is an important thing for us over here, Lindsay. By the way, tomorrow is Sjogren's Awareness Day. And so people who don't know about it, this is a really important episode for us on a personal level. There is a member of the staff here at Radio Nemo who actually suffers from this disease, has a good life, which is very, very possible. We're going to talk about that as well here over the course of the next 25 minutes or so, and absolutely thrilled to have them both here. Good morning to you both. Welcome to the show, and how are you this morning?
Good morning. Thank you for having us.
Oh, of course. And by the way, I'm going to make this really easy, guys. I promise you I will try to use somebody's name before I just throw a question at you. Is that fair enough? We kind of establish that as kind of the baseline. Doctor, let's begin with you. Because, like I said, I know a little bit about this because of my personal relationship with the person in our lives who has this. Can you talk a little bit and explain what Sjogren's is? And in doing so, kind of explain why it is important to continue to try to figure out a way to not only manage this, but to maybe find a cure.
Sure. So Sjogren's disease was initially described by a doctor in Sweden, Dr. Sjogren, and that's why it's spelled Sjogren. But he noted that some women with rheumatoid arthritis had severe dry eyes. And what it is a systemic autoimmune disease, which means that our immune system usually protects us. It identifies foreign invaders, and it keeps us healthy and attacks them. But in people with autoimmune diseases, their immune system can't tell the difference between what is foreign and what is part of the healthy part of the body. And with Sjogren's disease, the immune system is overactive, and it thinks that the glands of the body don't belong there, and it attacks the glands. And most commonly attacks the saliva glands to cause dry mouth, and the eyes to cause dry eyes. But it can also attack any glands of the body with dry, itchy skin, dry vaginal area. But even worse than that, it can attack any organ of the body, such as the lungs, the joints, the kidneys even. And we might not think dryness sounds so bad, but just think about it. We're all sitting here, and none of us notice our eyes at all. But the person with dry eyes, for example, they're just constantly having this gritty, itchy feeling, uncomfortable, painful feeling in their eyes, or dry mouth. They can actually lose their teeth at a young age because of not having the natural saliva to protect their teeth.
For the people listening, for our drivers out there listening, just imagine, not topping off the radiator. Just imagine not changing your oil. Just imagine doing that for long periods of time. And we are giant hydration machines. The human body is literally dependent on water. I mean, it's literally dependent on always, everywhere, all at once, making sure that the areas that can't dry out, don't dry out. And if I understand you correctly, and please, doctor, tell me when I am wrong, we're talking about the idea that it's like you've got to be perpetually vigilant for what everybody else is always kind of naturally able to kind of correct. Their bodies correct it on their own. These bodies can't, correct?
Absolutely. And Jimmy, I really love your analogy, by the way. And what you just said is exactly right. One of the staff members of the Sjogren's Foundation, she has bad Sjogren's. And when she gives a talk, she likes to say that having Sjogren's disease is like having a full-time job because the person is constantly having to work on keeping things lubricated.
Oh, that's a great way to kind of put it too, and it's like there's so many other things that people often diseases that people suffer from where they are in a perpetual state of everybody kind of understands it as well. I mean, I hate to use the example of dialysis, but people get that. That's something people get. But as you have well kind of pointed out, it's like, well, so you get some eye drops. It's not that simple, and it ultimately the other thing is too is that it wears and tears on our body's health overall, that if we don't do the kind of work we need to do on it, if we don't keep up with it, it is insidious, and we don't even realize what has happened to us until it's too late. Because the old joke about drinking water, I'm just using that as an example, not as a connective, but the joke about drinking water, by the time you're thirsty, it's too late. By the time your eyes get really inflamed, it's already beginning to have an overall effect, and a life of that, or a late life of that, can make for a very uncomfortable and very unpleasant and very unhappy, what I would call the third act. It prevents a vibrant third act from happening if not taken care of. I'm waxing about this. You can tell it's important to me, but I wanted to kind of pivot here as well. And Doctor, and also Janet Church, who is with us as well, can either one of you can do this. Who is at risk here? Who is at risk, and what do the numbers look like?
I'll let you
thanks, Dr. Thomas. Really, this disease can attack anyone. There are children that have the disease, young men, young women, but it has historically been a bit assigned to older women. And I think a big part of that reason is because older women have been living with the disease for so long that it's progressed to a level of dryness that is so painful and difficult that they are constantly seeking a diagnosis and eventually get diagnosed. Additionally, that the body's natural process of going through menopause can exacerbate that dryness. But it can attack anyone at any age. And we estimate about 4 million Americans have this disease, but only about half are currently diagnosed. And it does lean more towards a female ratio. About what we know at this time, about 90% of the patient population are female, where 10% are male. But it can impact everyone. And now that we're educating about that here at the foundation, we're actually seeing more and more children and young men and young women get diagnosed and come to the foundation.
Let me ask you a question. And like I said, I always ask questions. I never ask theories, if that makes any sense. I don't think I know. I'm actually genuinely asking. Do you think that the original thought that it mostly affected older women was because older women are alive? That so many men, for so many other reasons, women outlive men on a regular basis. And so in this way, what I'm hearing is that a lot more people across a much broader spectrum suffer from the disease, but it is a cohort of older women who actually, in many ways, like they always do, whether it's an election or whether it's in the workplace, have kind of taken the lead in helping point this out. Janet, I mean, is that what happened here?
I'm not sure if that's really a case. That's something that we don't talk about in the Sjogrens research community. But I think a relationship is definitely pre and post-menopausal women, that there is a natural removal of moisture due to the decrease in estrogen. But and I think that could be it. But there could be something about perhaps women. Research has shown that women are more likely to go to the doctor and speak up. So there may be a tiny bit of bias, but if you take a look at the entire autoimmune disease population, which is collectively about 140 diseases and impacts about 50 million Americans, but the ratio of women to men or female to male is 80% female in all autoimmune diseases compared to 20% male across all autoimmune diseases. So for some reason, and we don't really know why, autoimmune diseases do impact females more.
Well, Jimmy, I'd like to jump in here also, and thank you, Janet, for that. We do some very interesting research just came out recently that the Sjogrens Foundation highlighted. We're discovering more and more genes that actually cause Sjogren's disease. It's actually a polygenic disease. You have to be born with the genes to cause the disease, and something has to trigger them on. And some of those genes are actually on the X chromosome. So women are born with 2 X chromosomes, so immediately they're twice as likely to get those genes that can predispose someone to Sjogren's disease. We see the same thing with systemic lupus as well, because it has a similar female predominance. Number 2, about 1 out of every 1,000 women have something called trisomy X. They have actually 3 X chromosomes, and they actually have a higher prevalence of having Sjogren's disease as well. And then the highest incidence of Sjogren's presenting is actually in patients 40s and 50s. And as you alluded to earlier, this is a very slowly progressive disease. People don't even notice the dryness until they have lost about 45% of their saliva production and their tear production. So the disease has been going on for quite a while before the person even notices it. And estrogen, it actually increases immune system disease activity. And so that's another reason why we think that women are more apt to get it. So it probably starts, significantly earlier, before women go through menopause. And then when they go through menopause, it makes it even worse. So it's a very interesting on why women most commonly have it, but those are a couple of additional reasons why we think so.
Well, and pain is so confusing because pain can be coming from obviously a million different reasons. What did I do yesterday to what's going on internally? But it's fascinating how often people, maybe especially women, I'm not sure, are misdiagnosed or dismissed rather when something deeper is going on. And so what are some of the most common misdiagnoses that Sjogren's patients get stuck with before somebody finally connects the dots?
I'm going to comment a little bit on generalized pain and actually fatigue and what we call brain fog, which are 3 very common things in the rheumatic diseases, which Sjogren's is one of. So Dr. Thomas added in and explained a lot of the symptoms and the features of the disease, but part of the disease and the impact of inflammation is joint pain, muscle pain, and severe fatigue. Imagine that when you have the flu and it's just really tough to get out of bed, or when you do and you finally feel good enough to get up and go take a shower, that exertion of small energy makes you get back in bed. There are some people whose daily fatigue is at that level because of the disease. And then there's neurological impact to the disease for some people as well, causing peripheral neuropathy pain and other issues such as something we call dysautonomia. But pain is a significant part of the disease. Now, I think Dr. Thomas is better suited to talk about some of the things he sees as a misdiagnosis. So, Dr. Thomas, what are some of the things you see with patients?
Sure, yeah. And unfortunately, this is a classic invisible disease. You look at the person and they look perfectly healthy, but they could have just horrible things going on. Some common misdiagnoses, and this is common because, unfortunately, our diagnostic tests are not really very good. We need much better biomarkers or diagnostic tests to more accurately diagnose people. But a lot of women are misdiagnosed. For example, fibromyalgia, they'll be told that they have this disease called fibromyalgia where the pain nerves are overactive and causing pain throughout the entire body. And just given pain medicines and nerve pain medicines, told to exercise, told to decrease their stress level and so forth. And since this happens in menopausal women most commonly, then osteoarthritis or degenerative arthritis is a common misdiagnosis. In other words, it's just blamed on that instead of considering the possibility of a systemic autoimmune disease. Bottom line is we need much better diagnostic tests. We do have significantly good ways to diagnose it, but we need better testing, and that's one thing the Sjogren's Foundation is working hard at.
I wanted to kind of follow this up by saying the idea that this is a management process rather than there are no FDA-approved treatments here. In many ways, you have to be vigilant, as we talked about earlier, that constant lubrication that we were kind of, that you mentioned and alluded to. Talk to me a little bit about, and both of you can do this at length, and we'll start with Janet, about the management of this. About, we alluded to some strategies, but what are the actual specific kind of engagement where, you want to prevent other comorbidities from developing at the same time, because that's the thing that people don't realize, that often it's not the disease itself that will kill you, but the other things that often develop because of it.
That's absolutely true, and I appreciate your level of knowledge coming into this discussion with us, because you're really spot on. Managing the disease is really key. However, treating the disease is also important. So, for example, I do have the disease, and I have to manage it every day, but I also have a lot of complications, and so I have 9 different specialists that take care of each of my complications because of our medical system being specialized. So I have to go to a nephrologist for my kidneys, an oncologist for my blood clotting due to the disease, and then the rheumatologist and other specialists. So something that I really want to convey is that a lot of doctors who don't necessarily understand the disease and look it up might see the historical representation that the disease is just basically dry eyes and dry mouth. So what they might tell a patient is to stay on top of it with over-the-counter eye drops and waters and maybe some xylitol lozenges to keep your mouth moisturized. And that is important for our daily comfort, but it's also very important that that a patient is talking to a healthcare provider, most commonly a rheumatologist, that understands the disease and is looking at their lab work to see when they need specific types of treatment and to engage other specialists. Because just daily management with over-the-counter moisture items does not slow the progression of the disease, and it can progress, as Dr. Thomas mentioned. So that engagement with a doctor for what we call treatment, which is potentially prescription medications and other procedures that might be available for dry eyes, like IPL treatment for eyes, it's very important to take the disease seriously and make sure someone is protecting themselves as much as possible from progression. Now, you mentioned we don't have any therapy, systemic therapy specifically for Sjogren's, but this is also an incredibly hopeful time for the Sjogren's community because we have so many therapies in clinical trial. And it's not going to be all that long until we do have our first therapy come to market, and not that much longer before we have our second and our third. So it's a really, really exciting time. And, I'd love Dr. Thomas to weigh in on the importance of the therapy side with the patient. Dr. Thomas, how do you work with your patients on balancing that OTC management with needed therapy?
Sure. So there's a lot of things that patients can do to help themselves with the dryness. For example, having humidifiers throughout the home, using artificial tears regularly in the eyes. For the teeth, they can suck on xylitol candies to stimulate saliva flow. It also decreases bacteria. I prescribe prescription high-dose fluoride and mineralizing toothpaste for my patients so they can decrease their risk of losing their teeth. But for the immune system, we also have medicines that can calm down the immune system because that's the whole problem that's going on. So, for example, inflammatory arthritis is a common complication, and so we can use medicines like hydroxychloroquine, which, by the way, is not a cure for COVID, but it can definitely help patients with Sjogren's. Also, methotrexate is an immunosuppressant. Steroids is an immunosuppressant we can use. But the problem with all of these is none of them, as Janet alluded to, slow down the progression of the disease. None of them help decrease the gland damage that goes on. And so we're very optimistic about these possible FDA-approved drugs coming out soon. And I'm very optimistic that that's going to happen within the next year or two. It's just incredibly exciting, but that's going to happen. And Jimmy, by the way, I'm so happy that you're having this on your show, because I guarantee that some of your listeners or their spouses have dry eyes or dry mouth and just kind of pushed it aside and thought it was just from getting older. They need to go to their doctors and ask to be tested for Sjogren's. So thank you so much for having us on to discuss this.
Oh, you're quite welcome. And by the way, our good friend Trucker Boson, we actually have a large chat community that participates on the show by kind of chatting. One of them says that my dad suffers from SLA. He actually made sure he kind of put that in there. I wanted just for a really quick second, Doctor, and to kind of go back, to circle back, because I don't understand all the particulars. Janet mentioned that light therapy, pulse light therapy, actually can make a difference. Can you kind of explain to me what's going on there and how that is helpful? Because I love the idea of not just managing and having maintenance for pain, but actually taking active and vibrant steps to make sure that it doesn't accelerate, so that the people who right now are suffering, who don't have the answers they need yet, can hold the line when some of this hopeful stuff that Janet has talked about breaks through. Talk to me about the light therapy a little bit.
Sure. So one thing I like to point out, Jimmy, is that one of the most common antibodies that we see in our patients is called anti-SSA antibody. The SS stands for Sjogren's syndrome, which was the old name for the disease. But that particular antibody actually makes people ultraviolet light sensitive, and so it can ultraviolet light, even from indoor lighting, can actually contact the skin, damage the cells under the skin. The anti-SSA sees the contents and thinks they're foreign and binds to them and can cause systemic inflammation. So actually, for many to most of our patients, we do advise ultraviolet light protection and using sunscreen religiously, wearing a wide-brimmed hat when they go outside and so forth. So I like to emphasize that, because that's incredibly important. As far as the pulse light, I'm not sure what Janet was talking about. I do use it for some of my dermatologists. We use it for permanent damage to the skin for certain things, but I'm always very careful about that. Janet, I'd like to turn this over to you and get your comments on that.
Yeah, this is something that actually a dry eye, usually corneal specialist, but an ocular doctor might have available. And something that happens with severe dry eye is just like in our mouth when we don't have enough saliva to protect our mouth. If you don't have enough tear film and both what we call aqueous, so the water-based, and then the oils, which the meibomian glands produce, that you can get what we call blepharitis. And there can be all sorts of complications because of the dry eye. And there's just some procedures that ocular providers have that may be able to help. And so that IPL is something that might help with clearing up some of the issues that dry eye can exacerbate. So it was a very specific example that not a lot of patients use, but I was throwing out as there are therapies being used by especially ocular specialists to really support a patient's-specific journey should they have a specific problem, which is not necessarily a prescription medication. But that was a small example. But each specialist has their own toolkit, so to speak. When we start losing our teeth, how the restorative work process is certainly something that a dentist or oral care provider, an oral medicine doctor, will know specific steps for a Sjogren's patient. There'll be a different kind of care potentially, depending on what's going on with that specific patient. So each specialist has their toolkit to address. And that's one of the challenges of having, especially Sjogren's and lupus, is the diseases are what we call heterogeneous. So they show up in everybody potentially quite differently. And we might see a signature of a type of patient, a group of patients that the disease shows up in similarly, but it really is a very unique experience of how your disease impacts your body. Just like each of us have our own body and system, and it behaves the way individually it does, and so a disease expression kind of follows suit. But it is a challenge for doctors to truly manage a Sjogren's patient because I kind of call it a bit like whack-a-mole. Something pops up over there, and it might be Sjogren's, so it has to be investigated, but it might not. And something pops up later in another system area. It might be Sjogren's, it might not. Dr. Thomas, I'm so glad you brought up the sun sensitivity. Super common for patients, and wearing sunscreen is really important. I happen to not only have the light.
Janet, I'm going to put the brakes on you for 1 second. I'm going to do something we very rarely do here at Radio Nemo and Highway to Health. I'm going to ask you guys to grant me a boon. Let me go to my break. I'm going to bring you back for the second half of the show after about 2 minutes. I want to pick up this conversation. I want to make sure we put a button on it properly. So, guys, hold on tight. We're going to come back on the other side of this. I want you guys to go to sjogrens.org and find out more information about this. Well, it's insidious because it actually just grows and creeps if you don't take care of it. Our good friends Miguel and Lindsay have questions for you both. I want to address them really quickly here. Dr. Don Thomas, who is a Sjogren's and lupus specialist, and Janet Church, who is a Sjogren's Foundation CEO and a bravely, going through maintenance and also kind of taking care of herself as she deals with Sjogren's, have come back for a little bit of time here. Our friend Miguel Howe, who has joined us this morning from the studio, had a question for you, Janet, that he wanted to direct to you, and then maybe Dr. Thomas could take over after that. Go ahead, Miguel.
Yeah, thanks, Jimmy Mag. Janet, I was struck by a couple of things that you mentioned, right? One, you talked about the management and treatment of Sjogren's, and frankly, the comorbidities that come with that for folks, right? While we wait for these therapeutics, these exciting, cutting-edge, potentially therapeutics to be developed. And then you also talked about, our specialized healthcare system, right? And that you, as an example, have to navigate no less than nine providers. And so my question, Janet, to you and Dr. Thomas is really twofold. One, if you have Sjogren's or if your loved one has Sjogren's and you're trying to advocate for them for an improved quality of life, what are the kind of things as part of that wraparound management and treatment would you advocate for, right? Are there social, fitness, art, cultural kind of wraparound things that we might do if we have Sjogren's?
Right. So when there's a lot of ways my mind goes when you use the word advocate. So we certainly advocate and have patients join us to advocate in federal and state policy to try to make sure people understand the impact of this disease and advocating for yourself because it's such a complicated disease. And this is somewhere that a loved one can support someone that has Sjogren's. But advocating for yourself, if you feel your doctor does not know enough about the disease, get as informed as you possibly can. And the Sjogren's Foundation website is a good place for that, to get the tools, even the tools to bring to your doctor to help them catch up, because it's so complicated and it was previously thought to be a rare disease, which it actually is not. So many doctors did not get the training in medical school, so they're having to educate themselves along the way. So a patient needs to advocate for themselves. But within your life, how do you support yourself? You brought up some things that we all know we need to do, such as lifestyle management. It's very important when you're an autoimmune patient that you're really doing your best to manage your stress, eat healthy, exercise. And for an autoimmune patient, because we have pain, it's pretty tough to be going into a CrossFit environment because of the direct inflammation to your joint really fast. I actually tried it many years ago. It does not go well with it. But
good for you for trying, though, Janet. Well done. At least you gave it a shot. Well done.
Yeah, it didn't work out so well. But to walk, to stretch, yoga is a great tool for Sjogren's patients and lupus, probably any autoimmune patient. But, when you're removing that dryness, you kind of get feeling brittle as well. So keeping as they say, motion is lotion. So you got to keep moving to feel the best you can. A lot of us feel better when we reduce grains out of our diet. Not everybody, but I do. The more paleo I can be, the better I feel. But that is me and how my body works. But most doctors will recommend a Mediterranean diet. And I can tell you, as much as I have a sweet tooth, if I eat a bunch of sugar, the next day my joints are incredibly inflamed and sore. So if you are a patient and you're diagnosed, you can watch for the triggers that you have and then create your plan. And then if your partner and your family and your good friends who you're willing to share your journey with, they can support you well. It's also important for our family members to understand if we tell you we can't push through the fatigue, like I know we made dinner plans, but I am going to fall on the floor and I can't push through it, we actually can't really push through it. And if we try, we might have what we call a flare, which is the disease activating at a much higher level than normal and causing us to go down as if we had a flu. So that's a thing that family members can do to support their loved one with the disease. And then if you see your loved one is struggling with extreme tiredness, brain fog, and if they do recognize some dryness, fight for the correct diagnosis. Keep going to a doctor until you get the answer.
So Janet, I'm the dumb Army guy in the room, but what I'm hearing you say is...
Yeah, that's right, Colonel. Dumb Army guy. Got to the rank of Colonel somehow.
is diet, movement, flexibility, and your support team, right? Your family and friends that can be your battle buddies on the watch for you. And also...
Yeah, and I'd like to...
Go ahead, Doctor.
I'd like to jump in that Janet just covered a lot of great stuff, but all the stuff that she mentioned is also backed by medical science as well. We know that, for example, lack of sleep will make autoimmune diseases worse. We know that stress increases inflammation in the body and makes it worse. And in all the studies looking at the treatment of fatigue, exercise is the number one thing that's been shown to be helpful. And the NIH just a couple of years ago demonstrated that women who were forced to exercise with an autoimmune disease, they actually had a significant improvement in their mitochondria in the cells, which the mitochondria is the powerhouse energy-producing parts of the cells. And so it's very important as a physician that I do want my patients to work on lifestyle changes. I do believe in an anti-inflammatory diet. I want them to include omega-3 fatty acids to help decrease inflammation in their diet, eating probiotics and prebiotics, working on sleep hygiene to get a good 8 hours of sleep every night. And then for the exercise part, I'd like to emphasize start low and go up slow, because it is hard to exercise when you have a lot of pain and fatigue. But the patients who force themselves through it, they really do best in the long run. I can take two patients who had the exact same problems, and if one of them works on decreasing stress, practicing mindfulness and breathing exercises every day, eats a anti-inflammatory diet, exercises, works on their sleep, they'll do much, much better in the long run compared to the patient who doesn't. It's a lot of work, but it makes a huge difference in quality of life.
SJOGRENS.org is where you should go to find out more, to find out what you can do and how you can get involved. Doctor, Janet, both of you, Thank you so much. Lindsay's got one more thing she wants to bring up. Go ahead and fire away, Lindsay.
Well, no, I was going to say, so listen to your partner is what I'm hearing, but also, my husband always wants to cancel plans. This is very different. I want to end on a high with you, Janet, and just, this is probably basic, but also maybe profound, and we're about out of time. But if you could leave us with this, I always want to think about purpose sometimes through pain. So I'm curious to you what this disease, Janet, you living with it and also working with it, what has it taught you about resilience, or even most importantly, joy in the middle of a challenge? If you can leave us with that.
Oh, I love that, because that is something I try to do, is that you have to find how to balance things and find the joy. Because having a chronic illness, no matter what it is, but certainly Sjogren's, it is a difficult life to manage. And so you have to actively manage it and find your joy. It's very important. Find how you can still feel purposeful. It's very important. And it's sometimes a tough road to get all that in. But it's important to understand you can have a good life with conscious effort when you're living with a chronic illness like Sjogren's.
Beautiful. Focus on the joy. Not saying that that'll make the pain go away, but maybe it'll make it a little bit less, a little more bearable, so to speak. Thank you guys so much for making the time. Would love to have you back another time, actually. Great segment on Highway to Health. And Jen, that I'd like to wax poetic with them even more in depth another time.
We could have kept going. Thank you both so much. Janet Church, who of course is the foundation CEO, and Dr. Don Thomas, who is not only an expert in Sjogren's, but also a lupus specialist. Thank you so much both for making the time this morning.
Thank you so much.